Please be seated.
Good morning, Your Honor.
Good morning.
Here we have a very interesting case. Mr. Davidson versus Mrs. Davidson. So, Mrs. Davidson, you stand here in court today because the fate of your child having a father is dependent on today's result. And you are indeed here to prove that your ex-husband, Mr. Davidson, is the father of your child, Rashid Davidson?
Yes, Your Honor.
And you, Mr. Davidson, you stand in court today because you had a vasectomy performed a year ago. So it is medically impossible that you are the father. And in addition to that, all your 7 other kids look like you except him.
Yes, Your Honor.
Now, Mrs. Davidson, you say your relationship with your ex-husband has been a difficult situation since the vasectomy.
Yes, Your Honor.
Please do explain.
Your Honor, we were married for 7 years, and during that time, we had 4 children. After the 4th child, we decided that we did not want another. So we decided to look into the different forms of contraceptives. Finally, we came to a conclusion that he would have a vasectomy. The vasectomy went well, but to my surprise, after a few months, I got pregnant. Now, he is denying our 1-year-old child and accusing me of having an affair.
Okay, I see. So, Mr. Davidson, before this, was there a lack of trust in the relationship?
Well, Your Honor, to be honest, there was always trust in our relationship for the whole 7 years. After the procedure, I think she was having an affair because it was impossible that she could have gotten pregnant. Regardless of the fact that we did not use a condom, I am not the father.
Okay, thank you, Mr. Davidson. Before we get started, we invited Dr. Maxwell to the podium to give us a brief on the vasectomy. For those who are not aware, Dr. Maxwell is a urologist who specializes in the male's urinary tract and reproductive system.
Thank you, Your Honor. A vasectomy is a simple surgery that involves the cutting and sealing of the vas deferens. The vas deferens are ducts that run from the lower part of the scrotum into the inguinal canal up to the prostate gland. These ducts are cut or blocked off so sperm can't mix with the seminal and prostatic fluid to form semen. The composition of this fluid, which would be secreted after the procedure is completed, would only include those from the seminal vesicles, the prostate, and the bulbourethral glands. Where it concerns the advantages and the disadvantages of said procedure, the vasectomy does not affect the sex life or hormone levels. It's safer and cheaper, and it's also a minor procedure, meaning that the process is not long. It's usually done as an outpatient, so the patient can go home on the same day, and those are considered to be advantages. Similarly, there would be disadvantages, of course, where there are psychological issues which would lead to depression from the realization of not being able to reproduce. Also, it is effective, but it's not effective immediately, as it requires additional methods for up to 3 additional contraceptive methods for up to 3 months and does not protect against STDs. Also, it is associated with pain, scrotal hematoma, local infection, and swelling. Additionally, the procedure that Mr. Davidson's wife could use is a tubal ligation. Where concerns the tubal ligation, it is a procedure where Both fallopian tubes are blocked or cut, which is commonly referred to as getting the tubes tied, or also female sterilization. This is usually done with general anesthesia or local spinal anesthesia. And of course, this also comes with advantages and disadvantages. The advantages of a tubal ligation include the fact that it is permanent, it is safe and effective immediately, and does not affect the sex or hormone levels. Sex life or hormone levels, my apologies. It also has less side effects compared to other female contraceptive methods. However, in this case, you would also have disadvantages. The disadvantages of tubal ligation include that it does have a very low reversal rate. The procedure is also expensive and, similar to the vasectomy, does not protect against STDs. It does also have a psychological issue, and it is a difficult procedure which can lead to death.
Very interesting, Dr. Maxwell. So with the use of scientific justification, give your opinion on whether it is likely for Mr. Davidson to be the father despite the vasectomy he received?
Vasectomies, as previously mentioned, do not offer immediate sterility, as sperms are stored in the vas deferens and can remain there from a few weeks up to 3 months. As such, doctors do recommend that once the patient undergoes the procedure, that they and their partners continue to use other contraceptive methods, my apologies, such as condoms or birth control pills. This is so as following the procedure, it is estimated that about 20 ejaculations are required to clear out all the sperm. A few months after the procedure, a semen analysis is done and is used to determine if the vasectomy is effective. Rarely, there is recanalization, which is the process where the tube-like cells begin to grow from the cut ends of the vas deferens until they create a new connection, which would therefore be able to facilitate transport of sperm.
Thank you, Dr. Maxwell. Now, Mr. Davidson, you said you are now engaged to a younger female and wishes to have children with her?
Before continuing on to Mr. Davidson's concerns, I'd also like to state, for the purpose of court records, that there was indeed a DNA test completed, which will be, my apologies, revealed by the judge. We are concerned reversing a vasectomy, though a very rare procedure. Reversing a vasectomy does involve the reconnecting of the vas deferens, which would have been cut in the vasectomy, to then allow sperm to enter the semen. Since a vasectomy does not affect the process of sperm production, viable sperm are still produced. However, the success of the reversal in terms of achieving a pregnancy with the young female is indeed dependent upon the experience of the surgeon, the age and the fertility status of his female partner, and the length of time since a vasectomy. The female in this case has had, my apologies, the male, Mr. Davidson in this case, has had his vasectomy for a year, so should be able to reverse his procedure assuming he is still fertile. The name of these procedures are the vasovasostomy and the vasoepididymostomy. Thank you.
Thank you. Let's talk about the paternity. I'm ready for the results.
You are the father.